So, not directed at you, Mr. Gordon.
I'll do my best. Mr. Chair and members, I appreciate the committee's work on this bill, and I'm pleased to take the committee's suggestions outlined on page 9 of the analysis as author's amendments. These amendments would narrow the scope of the bill to apply only to video and telephone communications. It would clarify that the bill does not prohibit a health plan to undertake a utilization review of services provided via telehealth. It would clarify that the bill does not alter the scope of practice, and it would maintain the confidentiality of healthcare information and the patient's right to his or her medical information. As a member from the Silicon Valley, I've seen rapid developments in technology, particularly in health. Telehealth offers the reality of improved access of care for all, especially rural populations and the vulnerable populations with chronic illnesses that make it difficult for them to receive care in an in-person setting. Current California law recognizes telehealth as a means by which an individual may receive health care services. However, current law creates a barrier for patients looking to benefit from this alternate delivery service. If a provider wants to offer health care services through telehealth, the provider must negotiate with every health plan that covers their entire patient population. Providers already negotiate coverage and reimbursement rates in the contract, and telehealth should not be regulated differently for equivalent services that are provided in person. In addition, it is the intent of current law to ensure coverage and payment for services provided through telehealth. The language of the law is insufficient to guarantee the availability of telehealth. California law does not require health plans and insurers to include coverage and reimbursement for services provided to a patient through telehealth. As a result, coverage for services provided through this means may be denied to patients. AB 2507 removes barriers to health care services provided via telehealth and ensures patient access, choice, and convenience. Increased access to health care services through telehealth could also result in cost reduction and cost savings. Specifically, this bill would require the same coverage and reimbursement for equivalent services provided to a patient through telehealth as though the patient had received these same services in person. The modality of how the service is delivered should not determine whether a health care service should be covered. I would respectfully request an aye vote.
Thank you, Mr. Gordon. Your witnesses, please proceed. Thank you.
Good afternoon, Chair Wood and members of the Health Committee. My name is Kash Kapadia. I'm the Vice President and General Manager for Digital Health at Stanford Healthcare, the sponsor of AB 2507. As Assemblyman Gordon mentioned, there has been extensive innovation in telehealth technology, much of it developed right here in California. Telehealth has the potential to greatly improve access to quality health care for many patients. This is especially important since the implementation of the Affordable Care Act has resulted in 3.4 million new enrollees for whom we need innovative ways to deliver care. Telehealth has numerous benefits for patients. It provides greater access to primary care and specialty physicians, cancer clinical trials, and mental health services. It empowers patients to receive healthcare services faster and more conveniently, thereby reducing lost time at work, lost income, and travel expenses. It enhances the continuity and coordination of care, which is an essential component for delivering quality care. However, while California law recognizes telehealth as a legitimate means of healthcare delivery, a vibrant market of telehealth services that preserves patient choice does not exist today. Current offerings are fragmented, and patients cannot determine if their insurance will cover the telehealth service. Very often, they have limited choices in providers, resulting in uncoordinated care. Despite the potential to improve access and benefit patients, Californians do not currently have meaningful choices in telehealth. Further, numerous other states, including Nevada, Mississippi, and 23 others, have adopted stronger legislative safeguards than California to ensure that patients have guaranteed access and coverage for telehealth services. It is imperative that we address the current gap in California legislation. AB 2507 removes barriers to telehealth and will ensure benefits for patients and for the state of California. Patients will have increased access to effective quality care, including treatment for rare and complex conditions delivered by California's leading academic medical centers. The state of California will see economic and social benefits from a healthy and productive workforce and population. Further, telehealth offers a viable and scalable strategy for California to serve millions of new enrollees due to the Affordable Care Act. As the telehealth industry grows globally to over 100 million visits, California, the most innovative state in the nation and a pioneer in the world, cannot afford to be left behind. Thank you for your time, and we urge your aye vote on AB 2507.
Great, thank you. Please.
Mr. Chair and members of the committee, my name is Amy Clark. I'm a Community Engagement Manager for the Northern California chapter of the National Multiple Sclerosis Society. I've lived with relapsing remitting MS since 2002, and I'm currently using telehealth to see my MS specialist, who's a neurologist, and he practices in Sacramento. Prior to using telehealth, I had to drive a little over 2 hours to his office for in-person visits. Healthcare services being provided through telehealth is incredibly convenient for me because I live in Paradise, California, which is located in a rural area. Because telehealth is available to me, I can see my doctor via telehealth while in Red Bluff at an outpatient Dignity Health hospital facility every 6 months for a checkup so that he can renew my MS disease-modifying therapy. This is convenient and saves me both time and money. The telehealth visit is the same as it would be if I saw him in person in Sacramento and replaces my in-person visits. My doctor appears on a computer monitor in the exam room and is able to perform the same neurological exam as he would in person. He can watch me walk, touch my nose with my finger to his on the monitor, tap my feet, and do various other hand and foot movements to view my coordination and strength abilities. It's important to mention that AB 2507 is all about patient choice, and this bill in no way requires telehealth as the delivery of care. AB 2507 gives patients another option to access healthcare services. This is a very important point because it may not work for everyone, and at times it would not have been right for me. Because of the work I do with the MS Society, I know many people living with MS who want telehealth to be available to them. Many people living with MS can no longer drive or can't drive hours due to the symptoms they suffer from to see an MS specialist. I want to note that we have no MS specialists north of Sacramento. Many patients living in rural areas see a local community neurologist instead of an MS specialist and are not receiving the appropriate level of care they need to effectively manage their disease, and as a result, some have become more progressively disabled. If telehealth were available to them, they would have access to an MS specialist and could get the expert care and medical guidance they so desperately need. So as you can see, telehealth makes sense for patients on many different levels. It makes sense for patients like me whose MS is stable, and it makes sense for those who can't easily drive hours to see an MS specialist. I have a choice. I can choose to see my doctor in person or via telehealth, and it's my wish that every person living with a chronic disease like MS had that option. We have the technology to do it, and having access to a higher level of care could change so many people's lives and disease courses for the better. Thank you for hearing my testimony today, and I request your support of AB 2507.
Great, thank you very much. Others in support?
Good afternoon. Bless Shepard, representing the ALS Association Golden West Chapter in support, as well as the American Association for Marriage and Family Therapy California Division in support.
Thank you.
Amy Durbin with the California Medical Association in support.
Thank you.
Greg Herner on behalf of the California Life Sciences Association and El Camino Hospital in support.
Thank you.
Sherry Sager on behalf of Lucille Packard Children's Hospital, Stanford, in support.
Thank you.
Mira Morton here on behalf of the California Children's Hospital Association, also in support.
Thanks.
Kelly Brooks on behalf of the Association of California Healthcare Districts in support.
Thank you.
Ann Powell on behalf of the AARP California in support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California Chapter in support.
Great, thanks.
Jody Hicks with the California Academy of Family Physicians in support.
Thank you.
Lisette Short with Loma Linda University Health and Adventist Health in support.
Thank you.
Epilepsy California, representing the affiliates of the National Epilepsy Foundation in support.
Great, thank you. Anyone else in support? Seeing no one opposition, please come forward.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. First, I'd like to thank the author and sponsor. They did reach out to us early on to have this conversation about expanding the modalities and increasing the availability of telehealth. And for that, we are definitely not opposed. I think we're very open to having that conversation about making it more accessible. Unfortunately, the way the bill is written today, we do have concerns, and it's really specific to the fact that it does not protect against consumers with respect to tying something to the CPT codes, to requiring that it has to be initiated by the patient, that it has to be the same time and complexity of the service of an in-person visit. So initially, when we kind of looked at this and we started the dialogue about the modalities, we really centered around the issue of, in the bill right now, what it says is that these now video and telephone conferencing options will be reimbursed at an inpatient visit. So it doesn't create the sort of belts and suspenders and rubric around making sure that these are equivalent to an inpatient visit, or that they're not already paid for through a bundled service. With capitation, oftentimes these are a part of the initial payment. If a follow-up visit is within a certain time period, those are not reimbursed at the same level. Those are a lower complexity. So we're really concerned about the details in the bill, not necessarily the expansion of the modalities. It also has some language in here that potentially would interfere with our contracting ability. As many have experienced, there are options like Teladoc, where one of our plans will provide a telehealth option, which will be Teladoc, to provide all the telehealth services. That provides the same level of convenience for our insureds and enrollees. This wouldn't allow us to exclusively have those contracts and negotiate for better reimbursement rates through those contracts. So that's certainly a concern for us as we look at sort of cost containment and trying to increase access and availability to folks through telehealth, but also to make sure that we're looking at the constraints of cost and new mandates. So for those reasons, we remain opposed to the bill. We appreciate and will continue to have an open dialogue about the modalities, but we think we should look towards other bills that we have worked on. There was a Mitchell bill, SB 289 last year, which we really did work out a lot of these details and the specifics about the reimbursement rates, and to protect the consumers as well. These would be no co-payments and deductibles and cost share that they would be responsible for. So we want to make sure that there's those protections about the payment methodology in the bill. Thank you.
Thank you. Please.
And Jennifer Alley with the California Association of Health Plans. I echo the comments made by my friend at ACLIC, but I just really want to stress that we do support the objectives of telehealth, and my members do utilize telehealth in rural areas to ensure network adequacy. Again, it's around the structure of this bill and how it's developed, and it does lack those parameters for what code will be used. How will a co-payment be collected? Will there be any cost sharing that our enrollees responsible for? What exactly is, how will it be paid for? And with the payment parity that's in this bill for an inpatient visit, it does cause us some concern. This is the most expensive mandate today that you'll be hearing about. The cost for it range at the low end of, I believe, at $98 million and at the high end of $402 million. So when we look forward to improving access, we need to make sure that we take that approach in the right way. And at this time, we just cannot support this bill.
Thank you very much. Others in opposition?
John Winger on behalf of America's Health Insurance Plans would also like to thank the author and sponsors for the dialogue, but respectfully in opposition.
Okay, thank you.
Sherry McHugh, representing the California Chamber of Commerce. We appreciate the author's efforts and looking forward to continue to work with them. Thank you.
Thank you. Questions or comments from members? Seeing none, you did accept the amendments, Mr. Gordon? Okay, thank you very much. And the amendments actually do narrow the scope of the bill to apply only to video and telephonic communications, among other things. So hearing the concerns of the opposition, I hope that going forward, continue to work with them. I think there may be other avenues to be able to satisfy some of their concerns, and so I would hope that you would keep that dialogue open and continue. With that, I'm prepared to support the bill, and then obviously if there are major changes, we'll ask to see it back. So with that, I'll ask the Secretary to call the roll. The motion is do pass as amended to approach. I guess we need a motion. I'm sorry. Is there? So we have a motion in a second now. And now we can do the roll call. Thank you.
Wood?
Aye.
Wood, aye. Mainshine? Bonilla? Burke? Campos? Campos, aye. Chu? Dababne? Gomez? Gomez, aye. Hernandez? Lackey?
Not voting.
Lackey not voting. Nazarian? Olson? Olson not voting. Patterson? Ridley Thomas? Rodriguez?
Aye.
Rodriguez, aye. Santiago? Steinnorth? Thurman? Waldron?
Well, we're at 4-0. We're shrinking again. So appreciate that.
Best of luck.
We'll leave it open. Yeah, thank you. Thank you very much. So I would note also that item number 34, Mr. Chu, it was a vote only. AB 2725 has been withdrawn by the author and will not be voted on today. So moving on, Mr. Gallagher. Are you still here? Okay, yeah. Thank you.
All right, thank you, Mr. Chairman and members. And today I'm proud to present AB 2775, which seeks to provide women with information on all resources available to them when they are considering carrying their pregnancy to term. Now, last year, remember the legislature addressed the issue of transparency and care options by passing AB 775, the Reproductive Fact Act. And I know it's no secret that I was in opposition to AB 775 last year, and probably one of its most vocal critics. But I would submit to all of the members of the committee today that I think AB 2775 helped strengthen the transparency that was the intent behind 775, and really completes that circle of transparency that I think was ultimately the intent behind that bill. One of the biggest reasons that I did oppose AB 775 was that I felt that it was too one-sided, and it seemed to really only target the crisis pregnancy centers that many of us are familiar with in our own communities. And to me, I really felt like it vilified many of the CPCs in a way that I thought was unfair. And so a lot of my comments last year on 775 were really in defense of the women who work in these CPCs. I know many of these women who work and volunteer in these clinics, and I want to tell you a little bit about them because I think that's important. My wife and I, for a long time, have supported a CPC in our local community known as a Woman's Friend. And I don't want to embarrass this person or put them on the spot, and she might even be here today. I hope she's not embarrassed, but Janelle Trevathan is one of those women who I know day in and day out goes and helps women in these clinics, comes alongside women who are in a crisis pregnancy and helps them find resources. And every year that I go to the banquet, I hear countless amount of women who visited that clinic talk about Janelle and how important she was to them and counseling them and bringing them through. Members, these women are so much better than me. I'm pro-life, but these women every day put their faith into action, into works. And their heart is about helping women and helping them through some very difficult times. And to me, that's really important. It is not about deception. For them and for women like Janelle, I know that it's about her heart for helping other women in need. And so I think it's important that women know about this tremendous resource, especially if they plan to continue and make the decision to plan to continue the pregnancy. So my bill, AB 2775, would complete that circle of transparency for women weighing their options. My bill does not change how current law is structured, but it simply offers our information on alternative services by requiring public facilities that offer abortions to post a notice similar to what 775 required of the CPCs, with information on the services that these pregnancy centers offer. And also, I want to tell one more story because I think it's important, and you're going to hear from some witnesses here that I think will attest to this as well. Last year in attending the banquet, I heard the story of Haley, who came into one of these clinics, addicted to heroin, pregnant, not knowing what to do. The father, nowhere to be found. She came into a woman's friend, had a pregnancy test, but found out that she was pregnant, but not only that, had a counselor and someone who was there side by side to help her through that time. Haley ended up, not too long after that, going to jail. And maybe some people would think that's where this care ends. Absolutely not. Her counselor at this clinic was calling her, countlessly visiting her, helped her get out of jail, helped her ultimately get into a nursing program, where now she has passed that, has her nursing degree, and has ultimately had her child, and is in a much better place than she was before. And that's the point of this legislation, is for those who decide to have their child, there's a lot of other resources out there that are available, and we should make sure that they know about them. So with that, I'd like to turn it over to my witnesses. Today I have with me Wynette and Shante, who have personal experience with this issue. And I just ask that you listen to their stories, and ultimately I'd ask that you would support this legislation.
Thank you. 3 minutes each, please. Thanks.
And Chairman, my name is Wynette Sills. I'm the Director of Californians for Life. Despite the political polarization of abortion, I think there are some things that we can all agree upon. I believe everyone in this building wants to help women. We are pro-information and pro-women. And I give as an example a new documentary by the name of Hush, which I have asked to be distributed to each of you, produced by a pro-choice woman filmmaker. And it addresses the impact of abortion on women's health. Thirdly, we all desire to see the trend towards a lower demand for abortion continue, resulting in fewer abortions as documented by the Guttmacher Institute, showing a 48% decline in California abortion rates, and that's including both medical and surgical abortions here in our state. And that graph is included in the literature that you've been distributed. With these shared concerns, we are asking for your support for AB 2775, which gives women who enter a reproductive health care clinic and decide to parent access to resources and assistance so that they can fulfill their choice. According to Planned Parenthood's most recent annual report, when a pregnant woman enters their business, 94% are given an abortion, while only 5% of women at Planned Parenthood who are pregnant are provided with prenatal care, and less than 1% receive adoptive assistance. Clearly, more resources and information are needed. Few women really want to experience abortion, but feel that their circumstances may be so dire that they have no other choice. There is no choice when you feel pressured and desperate. Providing women with resources in a timely manner is critically important. This is a time-sensitive decision. Reproductive health care facilities are rarely sources of car seats, diapers, maternity clothes, transportation assistance, baby clothes, all the things that are listed in the resource pamphlet that I've provided for you. That is an example of what the pregnancy clinics that Mr. Gallagher's bill addresses and refers women to. We are asking our pro-choice legislators to support this simple referral. where women who have decided to parent, who are facing the many challenges of an unexpected or unsupported pregnancy, can obtain the community resources they need to fulfill their choice, their decision to parent their babies. Providing women with information about all their options and resources should be a priority for all legislators. Therefore, we ask for your support of AB 2775, and I'd like to, with great pleasure, introduce to you a young woman who is courageous. This is her first time to ever visit the Capitol. Shantae is going to share her story. You're ready.
Hello, my name is Shantae. I'm 18 years old, homeless, and pregnant. When I missed my period and thought that I might be pregnant, I turned to the same place where I've been getting my birth control pills, Planned Parenthood, looking for help. I went to Planned Parenthood on Franklin Boulevard here in South Sacramento on Friday, April 8th. They gave me a pregnancy test. The result came back positive. The options given to me based on my circumstances did not support my wish to keep my baby. I walked out with no resources and an uncertain future for my child. I had never felt so alone. The following Monday, April 11th, I went to the Sacramento Life Center where I was greeted with a warm, caring welcome. They supported my choice to parent my baby. I was given prenatal vitamins and am scheduled for an ultrasound to see my baby tomorrow. The pro-life community has taken me to Win Youth Resources, where I was able to get a voucher for a replacement California ID card, which would have cost me $28 with a California ID card. I can now apply for employment. I spent 2 hours at DMV, but I'm now one step closer to getting a job. I have interviewed, attended orientation, and look forward to being selected for the Women's Empowerment Program, which has a 90% success rate for helping homeless women, including pregnant women such as myself, gain employment upon graduation from their 8-week training program. The pro-life community has provided me with clothes, food, uniform, work, bus passes, transportation, love, and encouragement, even offering me a place to stay in their own home. I've been in foster care since I was a little girl, abused since I was 3 years old, but my life is not over. It's just the beginning. I deserve a chance, and my baby deserves a chance to live. Planned Parenthood is a good resource, but it is not the answer for everyone. For the thousands of women in California who are just like me, I am here to ask for your support for AB 2775. Women need to know that there is help available to them. Thank you.
Thank you very much. Others in support?